Prescription drugs have become the #1 choice for recreational use, and they're easily accessible through your doctor, your family doctor, in fact. And Dr. Belfar has more information for us. Good morning.
Good morning.
So it sounds like, something that would be obviously legal, healthy for us. It's our family doctor, someone we trust with our family's health, but we can actually run the risk of becoming a drug addict with prescription drugs.
Yes, well, Lindsay Lohan is the poster child for what I'm here to talk about, because she was turned into a drug addict with the use of a medication called oxycodone. And what reports have said and stated is that her family doctor was the one who prescribed it to her and essentially turned her into a drug addict. Now, besides Lindsay Lohan, other celebrities such as Rush Limbaugh, Macaulay Culkin has also been turned into drug addicts from this drug. Now, this doesn't apply to just celebrities. This is throughout the United States. In fact, the DEA has stated that almost 2 million people now are using prescription drugs like oxycodone for recreational drug use.
What other drugs besides oxycodone are in that category?
For that particular class of drugs, things like morphine, Vicodin, Percocet, another drug that's used, which is not in the class, but it is also Xanax.
Okay,
used.
so we get these drugs when we're in a lot of pain, we've gone through a surgery. How do we protect ourselves, though? Because sometimes we need that pain relief.
Well, that's true, you need it. And prescribed properly, oxycodone is an excellent medication for
So that's
pain.
the key, to prescribe it properly.
Properly, yes.
Okay, so that's the area where you really help people.
That's correct.
So what would a proper dosage be for someone?
Okay, some of the studies have shown that you really shouldn't be taking any more than 3 a day. And when I talk about 3 a day, I'm talking about the 30 milligram tablets. Those are these little blue pills. They're called blueberries on the streets. They're the ones people want. But for medicinal purposes, you should not be taking more than 3 a day. We try to keep people at 2 a day.
And you have some here. These are the ones you mentioned. They call them blueberries.
That's the blueberries.
I mean, they look pretty harmless. They're small, but they're very powerful.
They are very powerful. Now, let me tell you about these blueberries. What they are a synthetic opiate. Okay, that means it's derived from opium. Another synthetic opiate is heroin.
Wow.
These are essentially a pill form of heroin.
That's incredible.
Yes.
Now, let's say that, somebody becomes hooked on these drugs. How do they wean off?
Okay, well, when you say hooked on, let me explain what addiction is, okay? There are 2 words that I need to define, okay? Because there's a lot of different theories about addiction and what it is and urgings and cravings and all that. Just remember these 2 words. The first is tolerance. Okay, that means you need more and more of the pill, of the drug, to get the same effect. So remember I said 3 is the max?
Right.
Then you'll have patients getting 4, 5, 6. They need more and more and more of it. Okay? The second word to remember is withdrawal. If you do not take the medication, you stop taking the medication, you get sick. You get symptoms such as nausea, vomiting, diarrhea, sweating. You get goosebumps, and the hair on your arms stand up. That's called piloerection. That's the term for it.
And so those 2 characteristics tell you that you have become an addict.
Basically,
okay.
yes, those 2.
Before we leave, tell our viewers, if they are suffering from this, how can they get help, and where do they start?
Okay, now there's a number of programs, but what I have is first off, I call it the ASK formula, okay? And this is to just get started. Okay, the A is for awareness. Now, I've already told you and your audience about tolerance and withdrawal. Most people don't even know what that is.
Right.
If they feel that with the medication, if they're developing that, that's awareness. That means there's something wrong right there. S is seek help. You have to go to a qualified drug professional. You cannot go to the doctor who prescribed this to you. You can't go to your drug dealer.
Right.
Okay? K is kick the habit. That means you have to kick the habit. Just like any addiction, you need addiction treatment.
Right.
You have to do it. Now, the way we do it at Manhattan Medical and Psychiatric Services, we don't substitute one addiction for another drug. We don't put people on methadone or something like that. We systematically start lowering and lowering their oxycodone. As we do that, we have them in these educational groups We continuously educate them about tolerance and withdrawal, about the benefits of the medication, but at the proper dose, not at a high dose where they become like addicts. And I told you, oxycodone's like heroin.
Sure. It can become a very vicious cycle, and
That's
so you have to be
correct.
disciplined to break it. Thank you so much, Doctor, for this wonderful, helpful, very helpful information. Strong message.
Thank you.
Thank you. And if you'd like more information, you can visit their website at mmpscenter.com or give Dr. Belfar a call at 212-452-4657.